Good afternoon, everyone. My name is Simran Chaudhary, and on behalf of Voice of Healthcare, I welcome you all to today's panel discussion Advancing Kidney Health, Prevention, Innovation, and Patient Care. Kidney disease is often referred as silent killer, and for good reason. It develops quietly with little to no symptoms in its early stages, yet affects millions globally. As we mark this important discussion, we aim to raise awareness, explore advancements in treatment, and discuss strategies to improve kidney care for all. To dive deep into this crucial topic, we have an esteemed panel of renowned experts in nephrology and urology who bring decades of experience in kidney health, management, treatment, and innovation. So I'll introduce them for you all. Professor Dr. Sanjeev Gulati, Principal Director, Nephrology and Kidney Transplant at Fortis Group of Hospital, NCR. Welcome to our show, Dr. Sanjeev. It's an honor to have you with us.
Uh, Thank you, Simran. Great pleasure to be here.
Thank you, sir. Dr. Shrenik Shah, Consultant Urologist at KD Hospital, Ahmedabad. Welcome to our show, sir.
Yeah, good afternoon. Thank you for the invite.
Pleasure to be with you. Dr. Sudhir Ranjan Das, Senior Consultant and Academic Head, Department of Nephrology, Sir H.N. Reliance Hospital, Mumbai. Welcome to our show, sir. Thank you so much all for joining. And in discussion through the
Thank you,
next
Simran.
hour,
It is
thank
a
you, sir.
pleasure to be with you today, and it is obviously a great service.
Thank you so much, sir. And now, through the next hour, we will be covering four key segments: understanding the global burden of kidney disease, early detection and prevention strategies, innovation in kidney disease treatment, and challenges and future direction in kidney care. So, our discussion today will focus on practical solution, cutting edge innovations, and what we can do to tackle kidney disease at a systematic level. So, without any delay, I would like to start our conversation with Dr. Sanjeev Gulati. So, kidney disease is often called a silent killer. What are the latest statistics on its prevalence globally or and in our country?
Uh, yes, good afternoon, everyone. So, kidney disease is increasing globally as well as in our country. If you look at the international data, the this research suggests that about 10 to 15% of the general population, which means that about if you gather around 100 people, 10 to 15 would have some degree of chronic kidney disease. Indian data, the numbers are actually more scary. 15 to 20% is the prevalence in the general population. A did, uh, people coming to Fortis for preventive health checkup, so-called quote or unquote healthy people. So we just got hold of their records, and these were people who came and had gone back and never seen a doctor after that. So we thought, let's look up them, and we found that 10% of the so-called healthy people had chronic kidney disease. Last year, the Indian Society of Nephrology, I am the immediate past president, so we had conducted a countrywide survey where we looked at all diabetics and hypertensives who were coming to the primary care physicians. So we tied up with around 1,200 physicians. We trained them as to how to detect chronic kidney disease in terms of a urine test, which is urine albumin creatinine ratio, and uh, and an EGFR, which is based on serum creatinine. So we did these two tests in close to about 50,000 people, which included tier 2, tier 3 cities. And our results showed that out of these, about 28 to 30% have got chronic kidney disease. So that is the extent of the problem that is there in the community.
And like you said, it often goes undiagnosed. That's why we believe that we all are living a healthy life, but deep down something is affecting our kidney health which does not come out. And I believe it only gives signs and symptoms when it comes at a later stage. So
Absolutely.
yeah,
So,
that was
as you said, it's a silent killer, and people often wait for signs and symptoms. Signs and symptoms in kidney disease come very late in stage 4, and they're also non specific. So, they're not, you can't immediately look. That's why kidney disease is detected late, and that's why the guidelines suggest that we should screen for kidney disease.
Definitely so. So, as we're moving forward, my next question would be to Dr. Shrenik. So, what are the most common risk factors which leads to kidney disease, and why is this awareness still so low?
See, in our country, if you look at the regular awareness or the health checkup, maybe in the bigger cities, maybe there, but not really in the smaller cities. So what happens? Even the awareness to that extent, somebody would have. We get a lot of patient would have pain. Yesterday only we had a gentleman who had a solitary kidney, and stone would have come there, and he totally became anuric. So the awareness, they go to the local doctor will give some medicines. So rather than really investigating, getting the ultrasound, getting the blood report, so especially this is happens in a rural areas, but nowadays in especially the urban or the bigger cities, the patient also are educated. They are regularly getting. So the risk factors is you should really get the regular checkup done. That is one. As not only the basic lipid profile is important, many other things like we had a 2 weeks back a lady. She was 27-year-old lactating and she had a 9 centimeter kidney cancer. It was asymptomatic, and it was so apart from the blood test, the ultrasound is very important test because this kind of patients you picked up quite often, and that is why this is, I think, one of the very important thing to do. Apart from the blood urea, serum creatinine, ultrasound, uroflowmetry are the routine check that you should do.
Thank you, sir, for explaining on that as what all important it is and how, if not diagnosed on time, how it can lead to bigger problems. Dr. Sudhir, how does the chronic kidney disease impact overall health beyond just kidneys, including cardiovascular or metabolic health? Because, like we all are discussing, it the signs and symptoms comes very late. I believe at that point of time it starts affecting other, health organs also, and give some other signs and symptoms as well.
Correct, Simran. It is before discussing about the uh, what are the health risk and the impact of chronic kidney disease, let me just give you in its nutshell what is the function of the kidney, since many people don't actually agree or know what are the functions. One is the the hormonal functions, which is basically maintaining the blood pressure in our body and the range of blood pressure which has been body wants to keep it, that is controlled by the kidney itself besides the heart pumping itself. The other one is the hemoglobin, which is RBC production basically from your body, is also one of the kidney is major contributor towards that by releasing a hormone that is called as erythropoietin. Besides that, there is also a mineral, the bone strength of your body. That also is important. That has been carried out by our kidneys due to the production of active vitamin D. And that also, lots of other factors are there. Besides, fluid, electrolyte, acid base also is controlled by the kidneys. So multiple factors. So for that, you indulge in multiple organs are involved in that along with that. So obviously, when you are dealing with a chronic kidney disease, it causes a internal milieu change due to toxin which has been uh, not filtered properly, due to lack of erythropoietin, due to increased blood pressure, due to certain hormones which is accentuating due to renin, angiotensin, aldosterone axis maintenance. So, and the toxins gets accumulated and it causes adverse effect on your cardiovascular, not only cardiovascular structures, also the cerebrovascular, your brain also gets affected. So we call it as target organ damage. So the target organ damage is major organs of your body gets affected due to that. So you must be surprised to know that death due to the chronic kidney disease is seldom due to the disease itself, due to the uremic toxins. Rather, it is much more higher due to the cardiovascular death, which happens due to the chronic kidney disease. So it is obviously a risk factor for the health, overall health itself. So cardiovascular risk, why it is happening is probably due to the manifold rise of uh, in different stages of chronic kidney disease, the cardiovascular problem. The different stages can range up to the threefold rise from the general population to tenfold rise of general population due to enhanced atherosclerosis, due to vascular calcification, due to hypertension, dyslipidemia, cardiac remodeling, or arterial stiffness. All those things are basically positive effect for this overall health of our body. So chronic disease, kidney disease, rightly you have pointed out that it is a silent killer. Unless until it is picked up early, it can cause really a great degree of discomfort and later on lead to a serious condition.
Thank you, Dr. Sudhir, for explaining on how it can lead to other health issues and how it silently affect the other organs as well. Moving on to my next question to Dr. Sanjeev. So, are there any specific population which are more vulnerable to the kidney disease, and what targeted intervention can help them to get rid of, for the treatment options?
Yeah, so research has shown that although anybody from a newborn to an adult can develop kidney disease, but there are certain populations which are at higher risk for kidney disease, and we need to screen them. And these are: one, you have got if you have got diabetes; second, if you have got high blood pressure; third, if you have got cardiac disease; fourth, if you have got rheumatological diseases like lupus, rheumatoid arthritis. Okay, fifth, if you have got kidney stones. Next, if you've got family history of kidney disease, then if you are obese and age more than 40 years. So if you look at all these and you screen them, you will be able to, pick up those who are more likely or have early kidney disease or who are, So these are the target populations that we should screen. Now, I think your second question was regarding the interventions. Is that right?
Yes, definitely. Yes, sir.
Okay. So as far as the interventions are concerned, if you are a diabetic, the blood sugars have to be under good control. Your blood pressures also should be under very good control, which means having a blood pressure of 140 by 90 is not enough, which some people feel is normal. So research has shown that your target blood pressures at all points of time should be 130 by 80. Third, we also look at urine protein leakage. So we have now medicines available which can reduce urine protein leakage. Urine protein leakage, as I mentioned earlier, is one of the earliest symptoms of chronic kidney disease. So we have drugs like ACE inhibitors, angiotensin receptor blockers. Along with that, now we have got newer classes of drugs that have come up, and one of them are we call flozins. That is either empagliflozin or dapagliflozin. In the same category, we also have GLP-1 receptor agonists, and this is particularly useful for people who are overweight. This is a drug that came in for diabetes, especially, but it has been found to be beneficial in kidney disease. And the other drug is another drug called finerenone, which is a non-steroidal mineralocorticoid receptor antagonist. This again reduces proteinuria, specifically for diabetic patients. It's a very useful addition. In addition, we also have to, make sure that their cholesterol levels are under good control. And if the people smoke, then they should stop smoking. And their diet is a very important, equally important intervention. The diet should be low in salt, low in potassium containing foods, and phosphorus foods. Uh, but if it's a vegetarian, proteins need not be restricted, which is a common myth. Um, and they should lead a healthy lifestyle in terms of doing so at least 30 minutes of some kind of activity or daily and make sure they are not prone to it. So several interventions are available for
Thank
we
you.
are better armed. Yes, please. Sorry.
So your voice was cutting, yeah. So thank you so much, Dr. Sanjeev, for explaining us who all could be, vulnerable for these kind of kidney disease. And yes, we do have intervention, the treatments, the drugs which can, help us to get rid of these diseases. But as nowadays we are focusing more towards the prevention and rather than focusing more on the treatment. So, talking about the prevention, Dr. Shinik, what are the most effective methods of early detection of kidney disease? And are routine kidney screening recommended for high risk individuals, or who should all go for the regular screenings for kidneys as well?
Right. See, your this point is very important. Everyone, I believe, earlier it was like about 50 years or about 40 years people should get screened, but it is not necessary. Nowadays, in today's era, I would strongly recommend it. And it is not only the blood test in which we got complete blood count, renal function test, liver function test, apart from the serum PSA, that is for the prostate cancer also, above 40, which has been regularly been said, but I would add to that even the ultrasound should be added once a year, and even the uroflowmetry, which is very important. Is see, we had a gentleman who himself was a physician, and his creatinine went to 2.8, and then we actually did uroflow. It has been so gradually your flow would become less that you will feel like this has been a regular part. And then we did his TURP, the stricture was removed here, and then his creatinine gradually came back to 1.2. So this is possible. Like, as I said, even bilateral ureteric stone, somebody's create may go up to 10. But if the cortex is basically kidneys are 12 centimeter. If cortical function and kidneys thickness is good, and if you try to intervene in time, then you can reverse these kidney functions and things can become better. But if the same way somebody has a recurrent pyelonephritis, obstruction has taken, because every infection would take away at least 500 nephrons. One each kidney, we have two kidneys generally, and one kidney has almost 1 million nephrons. But it is important that we save each of them. So again, coming back, even after 40 years, every year you should get the apart from blood tests, sonography, Euroflow, serum PSA done to make sure that we do not have any, even the malignancies can be picked up earlier, because the some 3 or 6 or even 9 centimeter kidney cancer may not cause any pain. These are the silent diseases, and that is why ultrasound. See, if you get for pain or some other pain, gallstone pain, somebody will get the CT scan done, and you may picked up there is a silent 3 or 4 centimeter renal mass, and which can be very different. It can be very fast, aggressive, and those high grade tumors. So coming back to the your first point, yes, we should get as a routine health checkup, and in which these all things are important to do. Even clinical examinations, many times I think we do the digital rectal examination in which we pick up that somebody has a hard prostate, and if the prostate is hard, then we correlate with PSA, and then so prostate cancer, which is silent, can even become like, we many times get somebody as a already the limbs have stopped working, and when you really try to figure it out, it is a prostate cancer above 100 ps, and it has been metastatic. So these all cancers, even somebody like risk factor, I would say somebody who is working in the dye factories, chemical factories, they are very likely to have the bladder cancers. So we should get really regularly ultrasound done, because the bladder cancer is something where you can pick it up in the ultrasound at the earliest, maybe as soon as they reaches about a centimeter. Any symptoms like hematuria, all those should be earliest. We should really, could have been stone, could have been infection, could have been malignancy. So all these symptoms should be immediately evaluated. One must go to the urologist or the hospital and try to figure out what is to be done. So if they go to the physician or the kidney physician, then they would definitely be able to help him out what is required, and should be thoroughly investigated. And your second part of question, high risk individual, especially like we are those we have operated. I remember distinctly, somebody a professor came from MP, whose father we did a lap radical prostatectomy, and then we had advised him that you should get your PSA done yearly, because he comes under high risk category. 8 times more possibility of, if father has got, then son or his brother would have. So he got his PSA, normal range is 0 to 4, and as soon as his PSA went to 4.5 or 6, we got his MRI done. It turned out to be there was a Pirate 4 and 5, so we took a biopsy, and then we did his robotic radical prostatectomy. That is a few years back. But then he asked a very important question. Dr. Saab, how about I have two sons? These are the patients like in which we had sent at that. I'm talking about 10 years back. At the time, we had sent all his genetic workup, the blood we had sample, we had sent it to US. Nowadays, it has been done in Ahmedabad or many parts of the country, Bombay, Delhi, everywhere, I am sure. Then this genetic test, if it turned out to be positive, then the next generation we should do it. If it is negative, then I think we can just keep a regular follow-up, like, but the follow-up will start early. Normal PSA we do from 50 years, here we start from 40 years onwards. So I think we have to figure out who are the high risk individuals and the regular checkup. These are the, I think, two things strongly recommended.
Definitely, sir. And with this examples and case study, we got to know the importance of role of family history and how it plays an important role in getting diagnosed things on time. If father has an a son could have or brother could also have the same thing. So how it becomes very important for regular screening checkups, and not for them but for anyone. It will definitely come up at a later stage, but it would be very late. So if diagnosed on time, treatment could be start early. It The complexities could be better, less. So thank you so much for emphasizing on that. Moving on to my next question, Dr. Sudhir. So how can primary care physician play a stronger role in detecting the prevention of kidney disease? Because normally, urologists or nephrologists are the right person to go for any of the kidney matter. But how can the general physician help in this case?
Very good question, Simran. Actually, the primary physicians, for me, basically, they are the backbone of your healthcare system. So they are the front run persons who will be in touch with the patient, with the family quite often. They have a emotional connect with them. So when we are talking about basically the prevention, there are two kinds of prevention. One is primary prevention, and the one is secondary prevention. Primary prevention, obviously, when the disease has not happened, at that point of time, like Dr. Saha said, that family history. So if there is a strong family history, then you have to, the subsequent sibling of them or the daughter or son, whoever is there, they should be closely monitored. And when there is a suspicion about something is wrong, then you have to pick up early. So that is called as primary prevention. The second one is the secondary prevention. Already the patient is having the disease, and you are trying to restrict the disease. Either in non-communicable disease, it can be either restricted or it can be delayed. So chronic kidney disease patient, usually what we do certain maneuvers by doing something in the form of either drugs, either the basically modification of diet itself, then doing something like a change of the habits. So like quitting smoking, all those things which you can say to them. And those are basically more powerful when a family physician gets involved or a general practitioner gets involved. So if you, and that is where the family physician or the practitioner role comes into play. So if the timely reference, timely identification of the disease happens, then obviously we have many drugs, many other interventions by which we can restrict the disease or delay the progression of the disease. For example, let us say that the patient is having hypertension, and the family physician has detected hypertension. But whether the hypertension is truly a hypertension or It is just a office blood pressure is not enough sometimes. It it can be re-evaluated at a later period of time. So you have to ask them to change their modification in the lifestyle, and then ask them to come after some period of time for a reconsideration whether the blood pressure is high or not. So that impact the family physician should know, and then subsequently tell the patient about it, that you change your lifestyle, smoking to be stopped, reduce the salt intake, go for activities like some morning physical activities. So likewise, then you come back after say 7 days or 2 weeks after, and I'll check your blood pressure again. So similarly, if the hypertension is already detected, then it is not that end of the story after giving the medication, or diabetes is detected, then end of the story. You have given the medication, you have to closely follow patient whether target achievement of though that target has been already achieved or not. Let us say there is a proteinuria in the patient. So you are giving the medication to reduce the proteinuria. See whether the proteinuria is reduced or not, which is our telltale marker of our underlying kidney pathology, our kidney health itself. Likewise, hypertension. If you are just giving the medication but the BP is not under control, that is again is a problem. So they cannot come to a tertiary care center, see a nephrologist or a cardiologist or a super specialist again and again. So here, the primary physician has to take an increased role of taking the things ahead by repeated visits, doing that. And one another thing which I wanted to emphasize is timely referral, which has to be
Yes.
done appropriately. Thank you, Simran.
Very rightly said, sir. Timely referral is very important if any kind of suspicion is there by the primary physician. Then, if he directs to a best doctor or the right specialty for this, definitely it will help us to cure any kind of disease at an early stage. But just like Dr. Sudhir sir also mentioned about some lifestyle habits, Dr. Sanjeev, I would like to know what role does lifestyle play in kidney health, and what preventive measures should be emphasized to the public, and how better they can take care of their kidney.
So, if you look at the causes of chronic kidney disease, two of the top three causes are lifestyle diseases, namely diabetes and hypertension. So, if you can, prevent diabetes or manage diabetes properly, if you can prevent hypertension or control high blood pressure well, you can actually prevent chronic kidney disease to a large extent. Once you develop chronic kidney disease, it's impossible to cure. So that's why I tell my patients that you should treat your kidneys like diamonds. Once damaged, they cannot be cured, repaired or cured. So you have to prevent the damage. And in today's era, we have seen that lifestyle diseases have overtaken the infective diseases or the communicable diseases, as we used to call them. So if you have a healthy lifestyle, you can, to a large extent, prevent disease. And what is you can again, you should undergo a yearly health checkup. Make sure your sugars, you are not for a hypertensive patient, you should control your blood pressures very meticulously, or you should make sure that you don't develop hypertension. I'll come to the diet part. Diet is very important in both of these aspects, which means that Indian diet, as you all know, is rich in carbohydrates and also in simple carbohydrates. So we should have a healthy diet, which we call diet rich in um, fruits, vegetables, diet rich in complex carbohydrates and high protein diet. This is I'm telling for normal people in a day-to-day life, so that you don't develop diabetes, you don't develop hypertension. Take low salt, because Indians are the most voracious salt eaters on the planet. Control your salt intake, control your weight, don't get obese. Then avoid over-the-counter medications or self-medication. And in that sense, I'll also use alternative therapies, which are often unscientific and untested therapies. So, and exercise regularly. Yoga again is India's innovation. So yoga gives both mental relaxation. It de-stresses you, uh, and it also can lower blood pressure. There are several studies which have shown that lower yoga will reduce diabetic medications. It will reduce or stop. You can stop your blood pressure medication. So yoga or some form of exercise. And last but not the least, yearly health checkups. I'm sure you will live a healthy lifestyle, and you would, save yourself from the lifestyle diseases, and you will protect your kidneys.
Thank you, Dr. Sanjeev, for focusing on and emphasizing on important aspects how lifestyle factor can affect your kidney health to the public. As all these sessions and this platform only aims to aware and educate public, motivate them for the regular screening and diagnosis, so that they do not end up in a stage where they deal lots and lots of complexities related to their health. Um Moving on to my next question, Dr. Shrenik. Sir, can advancements in wearable health technology and AI based diagnostics help detect early kidney disease? As there are lots and lots of advancements, new technologies are coming up. So many features are there in the wearables we wear, that is a digital watch, and nowadays some digital rings are also there. So, what would you say on this?
Yeah, we have to move with technology. And I would see to add Dr. Sanjeev, which he very well rightly said. See, if you are watching, somebody is wearing some wearables or Apple Watch, every day you should keep a target. I would not advise, I will say what exactly I myself is doing. I would be keeping a target of every day I should walk for at least 7,000 steps. You make your own target by evening or late evening, even if you have not finished, try to finish that. That is one. Second, see, try to do what he rightly said. Yoga, I am doing for last 14 years. So keep doing it. Very simple. Whatever you are doing it, whatever you are comfortable. It is not yoga only. You walk. Third thing I would say, like if I have to go to civil hospital, my hospital is on fourth floor. I'll take stairs. My own hospital, Rishabir Hospital, is on third floor. I'll take stairs. So simple things. See, it is not necessary. Don't go to gym. Don't go for dieting. What you do, something which you can continue for decades, for years together. Don't do something which is you can do only temporarily dieting. You may do 3 months, you may cut down, or gym you go 6 months, you may cut down. But once you will stop, it will become reverse. So I think these are the one of the few things and real added thing of like what you rightly said, Apple Watch or something wearable you have wear. That also tells you about like even somebody has like anything wrong in the cardiogram, or like they may impulse has gone below 50, or you keep there are the barriers are there. So you have to keep those kind of your oxygen level spo2 also goes below. Then there is they would immediately inform you, especially this the abnormal rhythm is very important, that can be picked up, and that can probably prevent if there is some atrial fibrillations or some ventricular tachycardias have started, and if it has been picked up at that level, then that can really prevent the catastrophes. If something else is going to happen, that can be very well prevented. So I think variables is very important, and the role of AI. Yes, AI has already come in the mark. I mean, in a medical field and majority of the field. How or it is right now actually a extremely useful thing. I'll give you a few examples. Like previously, if somebody has a high PSA, see, PSA is a could be for the prostatic infection or could be prostatic cancer. Now, how to differentiate? If somebody's PSA is high, we used to take a biopsies. Nowadays, we just get the multiparametric MRI and this pyrids, which is been when the AI can probably tell you if it is pyrid 1 or 2. Even good radiologists, they obviously are going to add to that information. then we avoid biopsies and we just understand this is infection and try to treat the obstruction, remove obstruction, infection, and the PSA comes down. We had, I think recently, gentleman had a 37 PSA. We got the MRI done, turned out to be pyrite 1 or 2 infection. We did his TURP, and now his PSA and everything's back to normal. Similarly, this is one I said radiologically, pathologically. AI has come into that. When we do like RCC, the actual grading of the disease can be picked up by the AI, and they actually help. Earlier, WHO had only one classification of clear cell carcinoma in 1998. In today's time, the last year WHO came out with 28 varieties of kidney cancer. So that is all, and this very in detail determination can be really given by AI. You just feed up the exact slide, you put down your images, it will come out with that. No doubt, once one has to put down all the data to AI, but then it can be a fantastic help. So even during surgeries, we get three-dimensional. If somebody we do a hilar tumor and which has got very close to the hilar vessels, solitary kidney, then we do three-dimensional preoperative CT scan, and then AI even on table, which is actually in vogue, which is coming up, which will tell you if you are going to cut to a wrong area or which can be a vessels beneath that, it will tell you don't do that, stop yourself. So this is how probably AI is coming up, and it can be of extremely good help. Certainly there would be downside of any technology, but we have to look at a better side and take it in a right manner. So yes, AI can be of extremely help in urology or the whole medical field.
Definitely, sir. AI is very helpful in terms of our healthcare sector. It has come to diagnosis. It is there in the kind of surgery process, the treatment, and everything. It is we with the help of the case studies which is coming up, the researches. It's been defined that how helpful it is being, how it has made diagnosis easier, and like you said, how variables are making it much more easier to diagnose even the small changes in there, and how with the help of AI and this advanced tools of variables, we can detect our regular activities, keep track of our steps, exercise, pulses, and our heart rate. So thank you for shedding light on that. Moving on to the next topic, which is the innovation in kidney disease treatment. So, I would like to know from Dr. Sudhir, sir, what are some of the latest breakthroughs in nephrology and urology treatment that are improving the patient outcomes?
So, just to add on to the AI, the topic which has been discussed just before, this is also one of the tools which will be probably in near future will be available to everyone. And how it will be available is basically that by the retina images. So Microsoft is in the innovation of doing a retina scan with any device of yours, and then subsequently predict that the patient will be having this problems. Let us say that cardiovascular events in near future or in the far future, almost to the precision of almost 80 to 90%. So that is what is caused as innovation in AI in the primary prevention. Okay, so adding to Dr. Sarnik's talk, I just wanted to add this. And this is also one of the, besides the AI, which has been involved in nephrology practice and other things, the breakthrough which has been done recently is basically in the diabetic kidney disease. What Dr. Sanjeev Gulati has said, that the first three things which are causing this chronic kidney disease is diabetes, hypertension, and obesity. And the other one is the lifestyle, basically. Lifestyle in the form of environmental exposure and smoking, and besides that, the other thing. So, food habits, basically. So, these are some of the things. So, breakthrough is basically in the diabetes research. And we have seen that we call it as 4 pillars of diabetes prevention in diabetic kidney disease. So we know that the blood sugar control is essential. But besides blood sugar control, whether we can manipulate by reducing the severe the kidneys from getting increased damage. So that is where the research is going on. So what are those? One, Dr. Sanjeev Gulati is already has said that SGLT2 inhibitors and GLP-1 agonists. So these are basically the tools where the blood sugar control, besides it gives you a heart and the kidney protection. And probably there are more to it. We have just identified the tip of the iceberg uh, about the benefits of this. There are more to it, which could come in later experimentations. And it also there is a another drug that is called as finerenone, which has already been mentioned by Dr. Gulati. It is also an anti-fibrotic agent. So if there is any chronic kidney disease, so the progression goes due to the fibrosis which happens inside the kidneys. So if we delay the onset of fibrosis, then probably will protect the kidney. So that is how this drugs help. So there are other areas where we have immense breakthrough in the form of in autoimmune diseases, where newer drugs are available for treatment. It is not as old. If you take into account 15, 20 years back, we had only 3, 4 drugs which could be used for controlling these autoimmune diseases. But now there are a basket of drugs which are available, which are non very less toxic, more tolerable to the patient itself. Then other glomerular diseases also there are certain breakthrough has happened. And besides, there are also breakthrough in the hemodialysis. Introduction of hemodiafiltration in common practice due to the machine which are available nowadays. What is the difference between dialysis and diafiltration? One is by the technology itself, by convective clearance and the diffusive clearance. So diffusive clearance is little bit limited in giving you toxin removal. The larger toxins will not be able to be removed by the diffusive clearance, that is by the hemodialysis. So long-term aspect of hemodialysis in long run is not good actually if you take into account 10 years after the initiation of dialysis. So that's why we say that transplantation is much more better in giving a quality of life and the longevity to the patient than the hemodialysis per se. But with introduction of hemodiafiltration, frequent dialysis, nocturnal hemodialysis, all those things are basically responsible for increasing the longevity. The lastly is basically the kidney transplant. Earlier, we were having very limited number of drugs, but now there are lots of medications which are available to prevent the rejection. It is basically a fine tune between not having an over immunosuppression where the infection could be more, whereas if you do under immunosuppression, rejection can happen. So in transplant immunology or the transplant population, we take a balance, and it is much more easy to do balance by giving the newer agent. And we have seen that the longevity of the patient increases with better control. Uh, and the other thing is investigations in the transplant immunology, where we can say that this patient, the immunological risk is low, and we don't require much of stronger medications. Whereas in certain group of patients, we can identify them by different technologies, investigations, and by that we can say that no, this patient requires more immunosuppression. So precision medicine or precision uh, individualization of the patient can be done right now with newer technologies, newer advancement. I think that is what I have to say here.
Thank you, sir, for explaining us the latest advancements or breakthroughs in the treatment of nephrology and urology. But as this is also, as we're focusing on the treatment, Dr. Sanjeev, how minimally invasive and robotic assisted surgeries are changing the landscape of kidney care nowadays?
So I think this is a major advance. Earlier on, the surgeries used to be open surgeries, which mean long incision, long healing time. So you were in the hospitals for a much longer. Then came the laparoscopic techniques and the endoscopic techniques, which shortened this. And now we have the robotic assisted techniques, which have literally revolutionized kidney surgeries as well as kidney transplantation. The healing is quick. There is minimal scarring. You're much. You're able to get back to work. Duration of hospital stay is being shortened. So overall, the procedure is and the pain is less. So things have really changed a lot, and you need not be scared of a long, big scar after the surgery. So that's why there have been, many advances which make it much more, if I can put it, patient friendly. The treatments.
Thank you, Dr. Sanjeev. Dr. Shenwick, are there any significant advances in dialysis and kidney transplantation that are making the treatment more accessible or effective nowadays?
Yeah, definitely. I am just looking at the clock. I believe we are about to finish. Should I do it fast or do you have the time? Because I was just looking, your
So we,
target was 1 hour.
yes, sir. So you can
Yeah,
answer
I
that
would
in
agree
between.
that all of us today are quite tied up. So if we can finish off on time,
Yeah. And
that'll
I
be helpful.
normally believe we always finish in time. So okay, I'll tell in a very nutshell. See, the dialysis nowadays is very well available across
Hmm.
the credit goes to government, even smaller center, periphery, lot of PHCs, the dialysis centers are been coming up. And about the transplant, what has been already said by
So,
Dr. Professor
Sanjeev,
Sanjeev, that the minimal invasive surgery, like we do partial nephrectomy, we do laparoscopic surgery, we do robotic surgery, and second part, we do the donor surgeries by the laparoscopy. So earlier, the open incision was with a we rib cutting, and we were used to put a large incision. Nowadays, the donor will start walking from the same day evening, and then 2 days will go back to home. The recipient will go in seventh day. And as rightly been already said about, very good drugs are there. So the safety of the recipient is always there. So that's what from my side for this question. Please go ahead.
Thank you so much, Dr. Shenik. And as we are moving close to end of our discussion, I would just like to thank all my panelists for coming together for this session, for the awareness, as our aim is to educate, motivate, and encourage our audiences to take charge of their health, to come out of their fears and misinformation in their head for the regular screening, for the regular checkups. It is very important to so that we can avoid the last minute treatment option and the complexities which all the patient goes through, right? So thank you so much for sharing your valuable insights with us, your real life examples and case studies to motivate our listeners. It means a lot. Thank you so much for your time and your expertise. Thank you.
Yeah, thank you, Simran.
thank
You
you
did a
again.
good
Bye
job.
bye.
I think this kind of awareness programs are really good. Thank you. Thank you so much.
Thank you.
Yeah, I
Thank
think
you
it's very
for
important to give authoritative sources of information, and these panel discussions like this help reach out to the public, because in this era of social media, you see all kinds of unvalidated, unscientific information on the social media, which often mislead our patients. They come to us very late. They take alternative therapies and they end up harming. I think everyone who's there, I think we should put it up on. This should be freely available. I hope the links are available so that
Yes,
the
sir.
common man can take advantage of this in times to come. and very well
Yeah,
moderated.
and it was nice talking with Professor Sanjeev and Professor Sudhir Narayan. It was nice talking with both of you.
Same here.
Yeah,
Thank you, Simran.
same here, Dr. Sa and Dr. Sanjeev.
So,
So it is
thank you.
indeed
Okay,
a
see you then.
pleasure,
We
and
finish
it
on
is.
time. I think I'm happy we finished 1 minute before time. Thank you. Thank you so much.
Okay. Bye-bye.
Bye bye bye.